Hello everyone, this video is a walkthrough of the surgery section guidelines. Um, you might be able to tell that my voice is a little hoarse, so I'm going to really just try to stick to the surgery guidelines, and then I'll do some additional videos walking through some of the codes, okay? So here I have my 2022 CPT manual. You'll notice that this one is not tabbed. That's just because it's my extra book. You should still definitely be tabbing your manual. And I do have some extra tabs here, and I went ahead and tabbed the surgery section since that is what we're working on. So if you turn to page 87 in the manual, this is where we have the table of contents. You'll also notice that this is where there's some great blank spaces that you can write notes. Please, please write your notes. They don't have to be specific to this section or these guidelines, or even this one's about anesthesia. It doesn't have to be specific to that, but write yourself notes, okay? I've said it once, I've probably said it 500 times already. So table of contents just lists what is in the guidelines for the surgery section. To clarify, the surgery section covers the majority of this manual. It's in surgery code, okay? So you'll notice here, we've broken it down, which codes are covered by the surgery guidelines, and it's a lot of them, right? Several thousand. So once we get into the manual, you'll see that it is then further broken down by body system, but these guidelines apply to the entire surgery section, not just general surgery, not just integumentary. It's the whole surgery section. On page 88 is when we get started in the actual guidelines, and I'm going to touch on the things that are most important here. This introduction is just telling you that this applies to the whole surgery section. Services, this is specifying that office visit, consultations, things like that, those are covered in E&M. So those are not going to be in the surgery guidelines or in the surgery section. And special services, reports, things like that, that's in the medicine section. So there are other services that might be provided, but they are not included in the surgery section. Surgery section just includes, you guessed it, surgeries. And surgery can be very, very minor. It can be, you know, removing a mole, or it can be removing a stomach. So it can be all kinds of different things. But usually it involves some kind of invasive procedure, right? It's not simply a consultation or counseling or something, a recommendation, office visit. It's going to be something more than that. That's what a surgery is. The surgical package definition. This is probably the most important part of these guidelines that I want to point out. And the reason why I want to point this out is because you will likely see a question that maybe it doesn't specifically reference the surgical package, but it is wanting you to understand the surgical package. You will likely see a question like that on the national exam. So what the surgical package means is there are certain things that apply to every CPT code related to surgery, okay? There are things that are just included in a surgery. So what might those things be? E&M. I know I just said E&M's in a different section. But what we mean when we're talking about E&M in part of a surgical code is, say you are about to have a procedure, you're going to have your tonsils removed. Your surgeon, day of, comes into your room as you're getting prepared and lets you know what is going to happen, what you can expect in terms of pain or recovery. Make sure nothing has changed with your physical health, all that kind of stuff. That is not going to get a separate E&M code, even though, yes, that's a consultation. That is technically an E&M service. But when we're looking at the CPT code for this surgery, we're assuming that the doctor is going to talk to the patient prior to the surgery. We're assuming they are going to meet with the patient, communicate with the patient, and that's just part of being a good physician. That's just part of providing quality care. is making sure you communicate with the patient about what is happening. So we are not billing that separately. We're not adding an E&M code. That is just included in the CPT code. Other things that are included is going to be local anesthesia or topical anesthesia. If you are having a mole removed, we're going to assume that the doctor is not going to make you sit there while he cuts something off of your body without some kind of numbing agent. We're going to assume we're going to put some lidocaine on there. And while, yes, we do have that anesthesia section, that is really for procedures that are going to require additional monitoring. We're going to put the patient out entirely. We need a nurse anesthetist or an anesthesiologist. We need to provide a much higher level of monitoring and care rather than we're just going to put some lidocaine on your hand. All right. So local anesthesia, topical anesthesia, that's assumed to be a part of any surgical procedure that would require it. So we do not bill that separately. Immediate postoperative care. So this is dictating notes, telling the family, hey, your family member is okay, talking with the other doctors and nurses to kind of sum up what has happened or transfer care, whatever needs to happen. That is included as well. Things that happen immediately after the surgery that just relate to wrapping up that surgery and being a quality provider who's communicating what needs to happen next. That is included in the CPT code. We don't bill that separately. Same thing with writing orders. You might need some pain medication. You might need some other bandages or things like that that might be appropriate for you after surgery. That is included. We're not going to bill separately for writing out your prescription. Also, if the provider comes and checks up on you after the procedure, even if that is after anesthesia, you've woken up, they want to make sure you're okay, check you out a little bit, make sure everything's going right, that is included. Or even if they're doing some typical follow-up care, if you've ever had your wisdom teeth removed, you might remember, or you might not remember if you were particularly susceptible to that anesthesia, that your surgeon called you later in the day to make sure everything was going all right. Make sure you were recovering normally, had no adverse effects. That is just part of the surgical package. That is considered to be a part of that code. So any code that we use for surgery already includes these things. So the reason why I spend so much time on this is because I do think you will likely see a question on the national exam, or possibly just on one of your case studies, where it is maybe not specifically stating what is the surgical package, but it might state something like the provider met with the patient, performed a history and a physical, and reviewed the postoperative care instructions, counseled the patient on what to expect, and then performed the procedure. And then it might describe the procedure in depth. And then the options that you might see for that, these are all multiple choice, right? So what you might see, and let me grab a note card so what you might see is, all right, so doctor counseled patient, history, physical, and then procedure. So what you might see in your options, again, is you might see just the surgery code, which would be appropriate, right? Or you might see one that has the E&M code and the surgery code. And so what they might be trying to do here, yes, it's a little bit tricky. I know I always say AAPC doesn't try to trick you. There's no trick questions, but they are testing to see if you know that the surgical package would include all of these things. All right. It already includes them meeting with the patient prior to the surgery, the day of that surgery. Okay. So you would not need to code an additional E&M service. All right. We would just code that CPT code for the surgery. So that's why I spend so much time on it, because I do think it's important to understand that. Okay, I'm going to touch on a couple more things, but none near as in depth as that one. That's the thing I think is most important for the surgery guidelines. Follow-up care for diagnostic procedures. So we talked kind of about normal follow-up care is included in the surgical package. If we're performing a diagnostic procedure, follow-up care only includes the care for that procedure itself. What does that mean? You go in for a colonoscopy, and your doctor checks on you afterwards, provides normal follow-up care for that procedure. That's a diagnostic procedure. It's intended to find something. It's intended to diagnose something. But the normal follow-up care for that procedure is just related to the actual colonoscopy. Are you having any pain related to the colonoscopy? Any discomfort, any issues with the anesthesia, those kinds of things. If something was found, if you were found to have colon cancer during that colonoscopy, that is coded entirely separately. That's going to be listed separately, treated separately. Okay. That is not included as a follow-up. All right. That is not follow-up care for the colonoscopy. That is a new condition that has been diagnosed. Follow-up care for therapeutic surgical procedures. So what does therapeutic mean? That sounds very calm and comfortable and comforting, but therapeutic means we're treating something in this context, okay? So if there is a surgical procedure that is intended to treat something, maybe we are removing your gallbladder or something like that, the normal follow-up care is just for that procedure. It is just for the removing the stitches, checking on your pain tolerance, making sure everything is healing properly. If there are complications, if you develop an abscess, if you develop an infection, if your disease has recurred, or you have some other kind of injury that is caused after the procedure or because of the procedure, that is not included in follow-up care. All right. That is a new condition that's going to be listed separately. All right. So that's kind of the same thing as with the diagnostic follow-up, but it's just saying there's limits to follow-up. Okay. It doesn't mean if we are performing a dental procedure and we find a tumor, hey, that's all included in that dental procedure. Nope, this is going to be a new thing. We're going to have to treat this separately. That's what it's specifying. Supplied materials. Whenever we are performing a procedure, we are assuming that, yes, they're going to need to use a normal amount of materials, and those are all included in the CPT code. If we need to use extra things, we can code them separately. So that's what this is talking about. So if you are having and I think this came up in one of the discussions, you're having a procedure done in office, they have their regular tray of tools, and they realize, hey, I actually need a different set of scissors, so I'm going to go have to open up this other tray. They can bill that. They can say, oh, we needed additional supplies. We needed to grab this whole other tray, even if we just needed one thing from it. We can stop. So that's what that means. More than one procedure and separate procedures. I think I posted a video in the discussion, but I can post it again. These are related to modifiers 51 and 59, and there's some other modifiers that are also appropriate. But basically it's saying if you have more than one procedure at the same time or the same day, then you might need to use some modifiers, okay? If you had a major surgery in the afternoon, then you have to have a different major surgery in the evening. For reporting purposes, you might have to add some modifiers to indicate that there's more than one procedure going on. If there's more than one procedure going on at the same time, you may need to add those. So that's just advising you to check those modifiers and make sure you understand their application. The separate procedure, that's pretty similar, and that's related to modifier 59. And that's just saying if there's a procedure that is normally a part of another procedure that is normally included in a bigger procedure, but for whatever reason is completely separate, then you can use modifier 59. So I'm not going to get too into what those mean because it is pretty complicated. I'll actually post additional resources for that, but just know that these are talking about 51 and 59 mainly. And so if you want to make note of that and then review the resources that I have on those, that would be wise. This is the unlisted services or procedures. Every one of the guidelines usually has these, and you'll notice that this lists unlisted procedures for pretty much every body system. And that is because the surgery guidelines cover every body system. So these are the unlisted procedure codes. They are also going to be in the sections themselves, but they're listed here as well. Also, make sure you understand, I think we talked about this in anesthesia as well, that you will need a special report generally if you're going to be doing a rare, unusual, totally new procedure. You might need a special report for that. It's the same thing as when we talked about that with the anesthesia section. Imaging guidance is telling you that if we use imaging guidance, it needs to be documented, and there are appropriate codes for that as well. And then surgical destruction. So this is basically telling you surgical destruction is part of surgical procedures, and different methods of destruction are not ordinarily listed separately. So what that means is the different methods, we might just say destruction. We might not know exactly what it means. It might just be wrapped up into one code. And there are exceptions, there's separate codes, there's things like that that might be listed. You just need to be paying attention to what the codes say. I think both of these pretty much mean that. Pay attention to what the code is saying and make sure whatever you're coding is documented. We are not assuming things. We do not assume that imaging guidance for a procedure if it is not documented. Okay, so that's what these are talking about. So those are the main things I'm going to talk about here. If you want to read what implant definition is, that's okay as well. That's interesting and definitely important as well. I think it's pretty simple. But the important things that I want to reiterate here is, what does a surgical package mean? And what is follow-up care? Okay, those are very important to understand. Yes, I think the modifier issues are important as well. I'm going to post the separate resources about it. But the main things I want you to take away from this video are what the surgical package means and what follow-up care entails. Okay, if you have questions about this, please let me know. And I'm sorry, I am losing my voice. And we can cover it a little bit more in depth. Okay, post it in the discussion. We'll go over it some more. All right, thank you so much. Bye-bye.